Wonderful. Okay, so everyone, good to see you. As you can see in the chat, we're having people from all over the world with us today, which is great, all together for a nice conversation around deliberate practice research. So thank you all for being. Thanks to our speakers for being here. I'm gonna go ahead and present myself. Then Vidar, you can say something about you, and then we'll present our guests. So my name is Inês Amaro, and I'm a psychotherapist based in Lisbon, Portugal, and I am the president of the IDPS, the International Deliberate Practice Society. So for those of you who haven't yet met me, hi, good to see you. Vidar, you might want to say something about yourself.
Yeah, my name is Vidar Husby. I'm based in Oslo, Norway, and I'm a clinical psychologist and I'm faculty at Sentio, and I'm a founding member of the International Deliberate Practice Society. Just gonna let things stuff here. Just a second. Here we go. And I'm the author of a couple of books on deliberate practice in Norwegian, so you would have to learn Norwegian to read them. And I'm at the board of the International Deliberate Practice Society, where I work primarily on how to train supervisor skills. Yeah.
Great.
And
Okay.
our guests.
Yeah.
We
So, oh yeah, go ahead, Vidar.
okay. So we are very excited to have Gideon and Steven here, and we've been looking forward to it and planning it since maybe before the summer. Dr. Gideon Diamond. Gideon, are you there?
I'm here. Here.
Perfect. Hi. So,
Yeah.
Dr. Gideon Diamond is a psychiatrist with advanced training in psychotherapy, including intensive short-term dynamic psychotherapy, ICDP, and approaches like informed by neuroscience, prediction models, and memory reconsolidation. And his research interests center on how therapists can most effectively learn and refine their skills. And as part of his fellowship, he and colleagues conducted a systematic review on deliberate practice in psychotherapy, clarifying its evidence base and addressing competing theories. His work reflects a commitment to grounding clinical innovation in robust science and guiding trainees towards methods that truly improve therapeutic effectiveness. And we are very glad to have you here.
Welcome,
Thank
Gideon.
you.
And
Thank
Dr.
you.
Stephen Parker is a psychiatrist who works as the director, research, and clinical lead psychiatrist in early psychosis at Metro North Mental Health in Brisbane, Australia. He has completed advanced certifications in psychotherapies and adult psychiatry, and the predominant foci of his research have been in mental health services and medical education. He completed a PhD in 2020 and holds adjunct academic titles as an associate professor with the University of Queensland and Griffith University. Additionally, he is the trial psychiatrist for Queensland's first trial of psilocybin-assisted therapy conducted at the QIMR and focusing on people experiencing prolonged grief disorder following a cancer-related death. So welcome, Stephen, and it's good to have you here too.
Thank you very much.
All right. So this webinar really aims to kind of clarify what the current evidence actually shows about deliberate practice in psychotherapy in particular. So drawing on a recent systematic review, we will explore how DP is defined, where the research stands, and what remains kind of uncertain, and what this means for training programs, supervisors, and therapist development. The goal is to move beyond skepticism or enthusiasm and toward a clear, science-informed understanding of deliberate practice potential, as well as possible limitations. So as we go, I want to invite you to write your questions and doubts in the chat here, and we'll save some time in the end to go over those. Okay, so if you have some doubts, comments, things you'd like to ask, please write them in the chat. Okay. So yeah, Vidar, up to you now to take the lead.
Yeah. Okay. So let's start by talking about what brought you into this line of research? What prompted you to take on this systematic review? And did you have any expectations about what you might find?
Yeah, I think so. As part of my psychiatry residency, you need to do a scholarly project in an area that you find interesting. And I had seen, tremendous work from ISTDP therapists, videotapes of fascinating work of getting good outcomes.
Yeah.
And in my own attempts to go down that path, it was just realize how difficult it was.
Yeah.
And I think I kind of came across DP and with excitement and being like, oh, this looks like something that can really help provide stepping stones to get expertise in a difficult area. I think I took that enthusiasm to Steve and Dr. Parker for advice and shaping that into a scholarly project. I think, from his direction, we saw there was a gap in the research in terms of a systematic review, and that's how it kind of came about. But certainly, I came with it with enthusiasm, thinking that we're going to find great results here.
Yeah, great. Thanks.
In terms of me, I think I followed Gideon. So I had been working as the Director of Training for Psychiatry in Queensland, and Gideon was one of the people who I'd supported through that program. As a clinical academic, I'd built an interest in medical education research. And again, one of the hard things I find is there's so many trends that happen when you look at medical education. There's ideas that get traction and they move and they might be there for 10 or 15 years, and then something else may come in and take that on. And I mean, I am fairly pragmatic. I'm always interested in what is it, does it work? And I know that when I thought about deliberate practice and Gideon raised it with me, I've got another friend who likes to write a lot of editorials for journals and opinion pieces. And we had mentioned deliberate practice in these opinion pieces several times. And whilst I understood in the pop psychology way what deliberate practice might be, it was an opportunity to actually try and understand what it is and how it may be relevant. I think certainly for me, I thought, well, this is a modality of working and seeking to develop expertise that is intuitive for me. It fits with the way I learn. So I was interested in thinking, does the evidence sit there at the moment to support this and the enthusiasm that is there? And certainly people like me might feel looking at it thinking intuitively, this is how we should be working with people.
Great. Thanks. So your review emphasized confusion around the core concept itself. And one of your strongest findings is a wide variation in how deliberate practice is defined across studies. Which parts of the definition do you think are the most commonly misunderstood or misapplied?
Yeah, I think it's a big question and a big answer because there are many understandings and many applications, and also looking at how the definitions have evolved over the last 20 years or so. That it's been an evolving process. So what the leaders were saying was deliberate practice 20 years ago is different to now.
Yeah,
I think there's a few main distinctions to make. One is deliberate practice versus other forms of practice. And that goes, that we're not just talking about psychotherapy, but expertise in general. So, deliberate practice has its four key kind of tenets: individualized goal setting, you've got a coach or supervisor, you get feedback, and you've got repetition with successive refinement. Now, that's very different to, say, purposeful practice, which is when you might be doing something on your own, solitary, without a coach. And purposeful practice is different to, say, structured practice, where structured practice is you're working on an exercise as a group, so it's not individualized in a way. So I think that's one of the key distinctions. There's confusion and conflation of all those terms across the literature. So having a separation there. And then the next key separation is how deliberate practice is conceptualized within psychotherapy itself.
Yeah.
Yeah, and I think that will run to there's two main branches of that. You've got Rusmarani and Vaz and colleagues that developed the concept of deliberate practice around skill competence and skill maintenance, which very much looks at it being, you get feedback from a variety of sources. That can include your own reflection, your supervisor, the patient, routine outcome monitoring. From this feedback, you're then, okay, here's a single area of a weakness in the case. You review a videotape where the supervisor watches that. You identify an area of weakness, and then with the coach, you develop a procedural performance-based exercise to improve, and you successfully refine that with the coach until that skill is improved and at that level that you want. Now, that conceptualization is very different to Miller and colleagues' conceptualization of deliberate practice.
Yeah.
And that they would argue that a lot of the former, it would be more structured practice or purposeful practice in a way. They also would argue that focusing on skill development isn't what moves the needle in psychotherapy. That's not what causes outcomes to increase, but it needs to be focused on several factors. So, for example, with them, they get feedback primarily from routine outcome monitoring, and they have a blueprint of, a therapist will have a blueprint of their work. With routine outcome monitoring, you identify several areas of weakness. Based upon that, with the therapist, with your coach, you will then link that to domains that are associated with improving outcomes. So whether that is structural domains, hope and expectancy domains, alliance domains, therapist or client factor domains. And based on that, you then develop a learning project. So rather than focusing on learning a skill, you're looking at this diverse, sort of flexible learning project that is aiming to increase your routine outcome monitorings in that area of deficit. That might include doing skills, but equally, that might include looking at how text messages are sent out for follow-up to prevent dropouts. Or it might be doing some diverse cultural play experiences to understand cultural diversity more. So in that way, they're very different in how the actual concepts are operationalized.
Yeah, yeah. So these are you're describing differences, right? The differences in approaches, and both refer to this as deliberate practice. But do you also, when you went through the literature, did you also see like misunderstandings or something that was really in conflict with the concept itself?
I think the misunderstandings is that many things are purported to be deliberate practice and they're not.
Yeah.
And it's ill-defined. I think that would be the main comment I can make around that.
Yeah. Yeah.
I think you're right, Gideon. I think, often it's a bit like when I was using the term deliberate practice, using it like a catch-all phrase without actually not properly understanding what does this mean?
Yeah.
And what are the components? And I don't think there's one particular component that's important. It's actually when that term is used, what is being described. There are different ways that it can be used, but making clear what are the expected components that would be there and ensuring that they sit within that work. Or if they don't sit within that work, explaining why they're not there. And that could be even better. You might work out we don't need one of these components, and maybe purposeful practice is all you need, but without having the concepts clear and without knowing what it is that's being operationalized in a particular study or a particular program, it's very hard to then work to know what works. And it just is a lot like the common problems that sit within psychotherapy research generally, where you have a therapeutic model, but that may be applied very differently by different practitioners. Even when you have a study that's there, if you don't have those fidelity checks as well. So it makes it hard to know what are we talking about when we use this term.
Yeah, yeah. Great, thanks. So I'm gonna, sorry, Inês?
Can I do a follow-up question? I'm sorry.
Please do.
It has to do with, so you're it's purposeful practice versus, Stephen, maybe which was the other type that we were discussing?
Oh, I was just saying again, there are components you can take out, but if we're talking about deliberate practice, are those four components there? If that's the definition that
Right.
people are working towards, they are the things that you would expect to see there. And removing one of them, you would expect to result in a detriment to the learning experience and the learning outcomes for the learner or whatever other goals may sit there within that work.
So respecting the four components would be the one thing that would give us greater ability to compare, essentially. Okay.
I agree, yes.
Okay.
Could you, just for the audience, also just clarify what four components you are thinking of now?
Well, that was, as Gideon mentioned, in fact,
Yeah.
I compare, the individualized learning objectives, the presence of a coach, that focus on feedback and that focus on repetition. Is that correct in your understanding, Gideon?
Yeah, that's correct. Those would be the main factors. Yeah.
Great, thanks. Okay, so let's turn to the state of the research itself. What do you see as the single most important improvement needed for future DP research?
Yeah, I think as we were talking about fidelity to definition, that we can compare apples to apples, oranges to oranges, and that would be the main thing. Otherwise, it would be nice to see longer follow-ups and particularly client outcomes.
Yeah.
A lot of the results were sort of subjective-based therapist outcomes, short-term effects that tend to diminish over time. So definitely fidelity and longer follow-up with client outcomes would improve the strength of our conclusions.
Great, thanks. It's a very condensed answer, and it's very it makes a lot of sense. Yeah, I'm really glad that we are talking about these things. So,
and I would extend that from Gideon to say that not only fidelity to whatever concept is there in terms of this is what our deliberate practice intervention is, or this is how we're doing it, but actually then demonstrating that within the work. So in the way that the intervention is designed, making it clear that they're there, and then also having something that gives confidence to the reader that this has been operationalized correctly with fidelity as well. But I think it is hard, the single most important improvement. When I look at that literature, what I see is a lot of people working hard to do things better and working hard to help improve the learning experience and outcomes. And as a researcher myself, I know how hard it is to actually do research that's going to be of the scale and of the design when the resources are so limited that happen to be there as well. And I think, I'm sure you'll ask us that, but I kind of think that you could focus on very high quality RCTs and operate. You could also do research to focus on, well, we're defining a program very clearly. This is what it is. And then talking to people, talking to learners about their experience of that. I think that there are different types of evidence that can be there that could be very helpful. But again, that definition of this is what deliberate practice is here, and that confidence it has been done in that way is the critical step.
Great. Thanks. So you also uncovered in your review varied effects across studies. Let's unpack what these mean. So some studies show small improvements in skills like empathy or response quality. Do you see these as promising early signs or simply artifacts of weak designs?
Yeah, I think well, there's a lot of results generally pointing in one direction, so that's promising. However, I am quite cautious because the quality is very hard to be definitive. So for example, in terms of empathy, coming from the Barata study, it was very small sample sizes. I think they did two studies. The first one had 36 people in it. And then when they did another study, they controlled for practice effects and feedback effects. So practice effects that if I just merely do this exercise again and again, I'm going to get better rather than need the whole DP. They actually found no kind of improvement at all. But the second arm only had four people in it. So it's with the quality of the literature, it's very hard to be definitive. And although we have these sort of promising indicators under scrutiny or built out under better methodology and larger, I wouldn't have confidence that what we see at that small level would translate to the bigger level.
So, but do you overall, do you think we should be cautious or optimistic or both when it comes to deliberate practice?
Yeah, I don't know if I'm stealing this phrase from Stephen, but cautiously optimistic.
Cautiously optimistic. What about you, Stephen?
I would agree. Like, it is so difficult because it is so hard to do evidence generation in a space like this. There are so many practical barriers that are there. And when I look at what's there, the fact that you have many things giving a positive signal gives some confidence. Hey, this is worth looking at. This is worth thinking about. I think the risk is, for me, I wouldn't want to oversell it, as this is the thing that is going to fix all of these problems in this domain, or this is the thing that will revolutionize the way that we are learning or training in the psychotherapy context, because I don't think we know that. I think the risk that comes with that too is if it's something that is oversold without having that evidence to support that at the outset, the risk is then it falls apart. And there's like a fad and a trend that gets lost, and then something else will jump in and take its place. Whereas there's an opportunity to look at, is this working? Does it work? How does it work? What works here? And I would take all of these little things as signals of things that you would want to look at, in understanding what might be happening in this space. But again, to not oversell what we have at the moment in terms of the evidence to say this is what we should do. But sometimes we have to do something, and sometimes, often there's nothing and no alternative. So in that appeal to logic, as I said, for me, I think, well, this is intuitive. It makes sense. You have a structure. You've got objectives individualized around the person. You've got feedback. You've got a process that says it's not a single trial. It's an ongoing thing. So I don't feel dismayed by the lack of evidence. I think it actually looks like everything else I've ever looked at in the medical education space in terms of the quality of the evidence that's there. So it's not an outlier. It's actually a problem that sits there within how do we build knowledge in this space.
I think it reminds me of it's almost a force of nature in our field that idealization will backfire. So So I think that's how I'm hearing you, at least, and I think that makes a lot of sense. I wonder, what do you think are the risks of training as is, like the traditional training, like we do it normally?
Yeah, I think well, the risks are nothing changes, and the data that we have shows that outcomes haven't improved over 40, 50 years. So we're spending a tremendous amount of our time, effort, money, and attention in areas that aren't moving the needle. It's not leading to improvements. So if we do nothing, we're not going to improve. So I think that's the main risk of doing nothing. And that's one of the advantages of carrying this research forward and moving DP forward. But as you're talking about, something that comes to me a lot is that risk of idealization and mental health, psychiatry, psychology. We have a long history of that, panaceas, whether it's Freud, the serotonin hypothesis, or refrigerator mums, or whatever it is. So I think it's just being cautious there, because not wanting to get caught up in a washing machine for 10, 20, 30 years, only to come out the other end and be like, oh, that was a nice ride, but have we moved the needle?
Yeah. Great. Thanks. So you also mentioned in your study that the enthusiasm for DP currently exceeds the evidence. What do you think are the risks of adopting DP prematurely in training programs?
Yeah,
I
again,
mean, I
is
think.
the
Oh, sorry. Go ahead.
no, please, Stephen, please.
Yeah, I mean, I think it's hard to know based on what's there. There could be the risk that it does nothing and it adds no additional benefit, and people have invested a lot of time and effort into something or adapting existing ways of doing things where you don't get a gain from that. There could be a risk that it causes harm. Like there's not any signal that I see about that in the literature, but I do know that often we underestimate the potential for harm in ways of doing things, and certainly the systemic harm that can come from the cost of reorganizing training and education around a process to then have that moved away and move on to something else. There's also the potential benefit that might come if this is helpful, if this is assisting people. So I don't know. Like I think my word is cautious but curious,
Yeah.
and definitely again, looking at deliberate practice and those four components that are there, it aligns with a lot of other things that I think about as a health services researcher. This idea about a learning health system, this idea that we come to work every day getting information about what we're doing and thinking, how do we do things better? It kind of fits within these ideas that have traction and make good sense. So I certainly wouldn't think I'm very worried about deliberate practice. I think it would be really great to think, what is it? How do we use it? And how do we actually draw it to be effective? And the best way to do that. And it's not clear based on what we have at the moment what that should look like. I don't know, Gideon, your thoughts on that?
Not exactly the same. Yeah, yeah, exactly the same.
Okay. So if we allow ourselves some wishful thinking, like if you had no constraints, what could be the ideal DP study if you could design it tomorrow? What elements would it absolutely need to include, do you think?
Yeah, I think for me it depends if we're looking at individual therapists in the realm of they already have proficiency and they're looking to get expertise versus trying to gain skill competence in a training program. Um, for the individual therapist, I think Stephen was touching on it earlier. I'd actually like to see good quality, on lower on the hierarchy, like even just case studies
Okay.
of does this work, and you can be very you can keep to the fidelity of the definition of what you're doing. You can get a lot of qualitative data out of that that can be very helpful, and it can be clearly prescribed. And that would be useful. You could build on that by doing a collection of case series if they're working in a clinic or whatnot. And I know previous authors have tried to do that. But that's the kind of the data that I would really, really love to see. Or as we we're talking about, kind of earlier, the training programs that are already running, comparing that to other training programs before, like getting some data from that. I think that would be really useful, really real world. Um, for training programs in itself, I think that does lend itself to RCTs, in which case, ideally we'd have longer follow-ups and client outcomes with good, strong comparators with purposeful practice or structured practice or whatever, or didactic training.
Okay, thanks. So, Inês, do you want to continue talking about the conceptual and practical issues?
Yeah, sure thing, though. I am curious because I wanted to hear, Stephen, about the ideal deliberate practice study. Maybe you can share your thoughts there.
Yeah, I don't know if there's an ideal study for anything. Because I think there are many different types of knowledge that people can gain, and as Gideon mentioned, two different levels of knowledge. And the ideal study may be completely impractical and infeasible. Like you having some RCT that's designed somehow with fidelity, with video recording of every session, video recording of every supervision session, and it's never going to happen. But I think that what I mentioned before, thinking about that qualitative research, I think would be a really useful way in my mind to look at this. Particularly if you have a training program that's using deliberate practice in a particular way, and looking at the experiences of people in that program of learning under the deliberate practice model. Because I think that again, probably much easier to do than that quantitative evidence, but also if you've got your therapists in training, if you've got your supervisors who are saying, this is a powerful way to learn, or this is actually very different to how I've worked before and I value this, I think that's the signal that would give me confidence as an educator, that, hey, this is something useful. And also would make me want to look at my neighbour who had published that paper and think, what are you doing? How are you operationalizing deliberate practice? And I think part of that too, is that kind of sharing of models of how this is being applied to help people to think about, what may work and what may not work in a particular context as well.
Yeah. Well, I'm guessing that over the next maybe 5 to 10 years, we'll have some of those come up. I mean, we have like a growing body of education services that are implementing DP. So perhaps the idea of qualitative research based on these experiences is not in the idealization stage anymore, or
Yeah.
maybe it's not as abstract. So hopefully we'll see something in the future. Yeah. Thanks, Stephen. So maybe I kind of wanted to move beyond the focus or the scope of your paper into a more open conversation about conceptual and practical issues of deliberate practice in general. So maybe Gideon, what do you think that makes deliberate practice so appealing to therapists and supervisors?
I mean, the words that come to mind is like it tames the beast almost. Because I think, therapy or my experience of psychotherapy is such a complex, nuanced, invisible, implicit, faceted, dynamic being, and it's exasperating, especially as a junior therapist, trying to be like, well, I just want to get better, and how do I do that? Deliberate practice, and that is absolute credit to all the authors and researchers that have taken this and built this DP framework for psychotherapy. It brings that, it grabs that the mythical beast and starts to create these kind of clear stepping stones. And it has a lot of intuitive appeal, face validity, and it breaks it down into easy steps. And that, to me, that's why deliberate practice appeals, and I imagine that's why it appeals to others.
Yeah, I was thinking as you were saying how we need, more better research so that it doesn't become, an attempt at getting some control over this, or a fake sense of getting control over these things that make young therapists really anxious, right? So it moves beyond that. We do need better research um, to tame the monster, because I think that it is likely that we might, or at least, I mean, comparing training as usual to deliberate practice, it seems much more concrete, which is something we kind of need getting started, right? So
Mm.
I think what's missing is really just the chance to have science support that in a way that can make it just, you know, strongly, just to make it more applicable across training programs in a way that is scientifically based. Stephen, what about you? What are your thoughts on this?
Oh, I was thinking I should have disclosed that my psychotherapy framework is predominantly cognitive behavior therapy. So deliberate practice, it kind of fits, like it's about checking in. It's about a coach. It's about, testing things out and getting feedback and looking at that. And even as a therapist, that idea of checking in and checking out and getting that feedback. I know in my own psychiatric training, I got what I would consider to be constructive critical feedback on one occasion in my 5 years of training. It wasn't that I got destructive critical feedback, I just got nothing that
Yeah.
would help me to see what I could do differently. And I think there are a lot of people who are really wanting that, but not knowing how to get that. And I don't know what it's like in other countries. We're an international audience, but in Australia, something very strange has happened in the last 20 years where the capacity to give feedback in training and education spaces has become very diminished. Supervisors feel a lack of confidence to do that. And whilst supervisees want it, something's happened in that dynamic to make that very hard. And I think for me, part of the appeal of the deliberate practice framework is this structure and the focus that this is part of what you do. This is part of how you learn. This is part of how you develop to be the best professional you can be at any given moment, but not forgetting that you're continuing to focus on the idea of learning new things and finding ways to do things better. So for me, I think that's probably the appeal in it, that focus on feedback, that focus on repetition, and that focus on that kind of openness and, the zone of proximal development idea as well, which there's a lot of stuff that has come in terms of the educational literature, which I don't think has translated well, into the medical education and the psychotherapy education also. But
Yeah.
it does encapsulate that.
Yeah. I mean, I agree with what you're saying. I think that we yearn for feedback and there's not a lot of it, or there's very, very little of it during training. And I think that even links to maybe a broader issue that is, at least here, I can speak for Portugal. I don't think I can speak for other countries, but you can comment on the chat if you have some ideas of how it's done where you are. But we yearn for feedback, but then in training programs, most programs don't use videotaping in the sessions. So, how can we even begin the conversation about feedback if recording your or being watchful of your performance isn't something that is broadly used? So, you do get feedback, but you get a lot of conceptual feedback, right? Um, your client is struggling with this, try this, experiment this technique, read this chapter, right? So you have a lot of conceptual feedback, but you don't get procedural feedback, right? Which is perhaps at least here where I am, it's one of the main issues. Like, you don't start the conversation around feedback if you haven't yet agreed that videotaping, doing outcome monitoring, all of these very basic things, yeah, if they're not part of your training programs in general. Yeah. Yeah, so maybe we can move forward a little bit. And I want to ask, maybe Stephen, we can start with you. Critiques argue that DP doesn't quite translate from other fields like music or sports into psychotherapy. Where do you see the concept kind of fitting well, and where might it struggle?
Yeah, I don't see that struggle hugely myself. I think, psychotherapy is a bit like a team sport, or doubles tennis or something like that. It you're still doing something. There are things that are happening and things that you're required to do and skills that you're drawing on, but it's within an interpersonal space. So I think that there is a layer of complexity that is added onto that needs to be considered, that interpersonal element. But I don't see there being a disconnect or, oh, this cannot work here. Provided that part of that feedback, and I imagine a very large part of that feedback, is around the interpersonal aspects of, the dynamic that might be there between the therapist and the client, or even the interpersonal aspects between the therapist and the supervisor, depending on what's going on at that particular time. So for me, I don't see a huge disconnection.
Hmm. So based on what you're saying, it's kind of like you learn guitar, but each person, each client is a different specific type of guitar that you kind of need to adjust to.
Yeah, or you learn guitar, you learn guitar, but you're expected to play to a different audience, or you're within a different orchestra or a different band,
Mhm.
and you need to be able to adapt to the other people in that context. So not just purely about refining a skill. And we all know, oh, sorry, I shouldn't speak, people who are highly technical musicians, and often it doesn't grab me emotionally. Someone can be far less technical, but when they have that understanding and that connection with the others in the space, with the audience or the other members who they're playing with, it's a profoundly different experience. So I
Yeah.
don't know if that answers your question.
Yeah. And Gideon, what do you think about this applicability from other areas to psychotherapy?
Yeah, I think that I mean, I am naive to to the expertise and the nuance of other areas, but I just perceive psychotherapy and, particularly, let's say, psychodynamic psychotherapy or attachment-based psychotherapies, um, as being a lot more complicated and complex than, tennis or sports or music or chess, whereby the rules of the game, in my naive opinion, would be a lot more clear, and the biomechanics and how it works and how it moves, versus a in psychotherapy or um, psychodynamic psychotherapy or whatnot. There's just so much, it's like playing, if you're Harry Potter fans, like Quidditch on steroids, and things are invisible. There's so many things that are moving around. There's defenses, there's anxiety, there's, it's the emotions. If that's your model, it's what's happening within the patient, what's happening interpersonally. It's your theory of change, all kind of invisible. So I think that it's much harder to apply it to psychotherapy because it is so complex, which just furthers my admiration for everyone that has worked very hard to apply it, and it sounds in the really great ways. Um, but I think that criticism is fair because of the complexity of the nature of the beast of psychotherapy.
Yeah, I was thinking about what you were saying earlier, right? About the mythical beast with all its nuances and complexities and yeah, and it is hard to capture that. And as you were saying, I was thinking, um, I think we're never gonna get a full kind of application, right? Because it's such a complex issue compared to just behavioral skills, right? Because there are so many skills that are not behavioral, they're conceptual, intrapersonal, right? Interpersonal. So there's a lot of layers. At the same time, if we could get most therapists we know doing the behavioral part better, just that, maybe that would make a big difference. And I'm thinking about, just the general idea that, again, speaking from my reality, many of us are doing work that is not on the 90th percentile, right, in terms of effectiveness.
Yeah.
So just thinking about even if it's a small similarity between, other things that are purely behavioral, I think we'd still go a long way if we could get just the behavioral part much better for most therapists and psychologists. But yeah, that's my personal take on it. Um, yeah, so thank you both for your thoughts there. I think we might maybe ask another question, Vidar, and
Yeah,
perhaps start
let's do
wrapping
that.
up with
Sounds
Q&A.
good.
Okay, great. Yeah, so let's kind of zoom out the broader issue of maybe how therapists grow in general. And research suggests that therapists don't really improve much with experience alone. And in your view, Gideon, can deliberate practice kind of counteract this stagnation, or do you think the issue is deeper than training methods?
Yeah, I hope so. I hope so. I think this, and I think we all sit here with hope. We just don't have the evidence for it. I think that, when I talk to therapists that I really admire, one thing that is in common is that they're all committed, and they're all practicing, and they're all learning. And very interestingly, one of the first studies that came out around deliberate practice is Chow 2015, and the way that his questionnaire for deliberate practice, how it was defined, was very broad and very loose. It wasn't deliberate practice as we define it now at all. In fact, it was, it might even have contained didactic training, spending time doing that or going to a workshop. Can't remember for sure, but it was definitely broad. And that study did show that those that were committed, it improved. So it may not necessarily be the deliberate practice as we've defined it, as leads to the improvements. I'd hope so. I think there are deeper issues. Again, as we're saying, the science behind kicking a football or playing a piece of music is largely defined, I would think, in my naive opinion. But we're still at a theory change in how the brain works and how change occurs. And as long as that occurs, it's very hard to build a solid to translate something to it, because there's theories and they change over time. Interestingly for me, a few years ago, I was like, okay, what, change is because emotional experiencing, once you get emotional experience and you feel that attachment-based trauma. And then more recently, kind of been looking at, another theory that says, well, actually neuroscience might say, or this aspect of neuroscience might say that's not actually what's happening. And these concepts of defenses don't actually exist. But here's another model that can kind of explain it, and another mechanism of change. So I think there is deeper complexities that makes it's not so simple. So yeah, I'm hopeful deliberate practice will help, but we have to see. We have to move forward with humbleness and see where we get.
Well, like you're saying, as long as we remain curious and eager to develop and learn more, that should be a good start, right? Yeah.
Absolutely.
Stephen, what are your thoughts on this? Oh, I think you're muted.
Sorry. Oh, good. I can rephrase what I said. I just say I'm always quite naive and optimistic, but I mean I am hopeful, but again cautiously hopeful, because when I think about what deliberate practice involves and those components, it involves a purpose. What am I trying to do here? A coach, a supervisor, which is what most psychotherapies are already focused on, having someone there who you look to with expertise that you expect to help progress you further. And that feedback, which we know is what is needed to allow an organism to change, to do things differently. So I think it actually fits very nicely with a lot of the components that we already have within psychotherapy as part of what good practice should be. The reality is often that isn't what practice is or what goes on. Often there isn't the feedback. Very rarely, certainly I work in the public mental health services, access to supervision becomes very hard or it falls down. I do have a part of me that thinks another thing that I used to be involved in researching was Balint groups, and there's so much enthusiasm about Balint groups as a modality to enhance the well-being of therapists and improve psychodynamic thinking. But again, I'm conscious that there are people who are attracted to learning in that way. Again, much like when I think about what attracted me to deliberate practice, I want to be extended. I want to be challenged. I want someone to help me to see the things I can't see. So possibly part of this is a mindset as well. So I think definitely am hopeful that this is something that can contribute, but I also think having people having the mindset where this is what they're wanting as a way of learning, is really important as well. But maybe part of that is that enculturation very early in psychotherapy training. This is how we do things. Back certainly in Australia, you have very little video supervision. You have very little, one-way mirror work. You know, all of those things that my understanding used to be core parts of what were there as training psychotherapists are no longer part of how we learn. How do we bring that back? I think is a key thing as well, and help people to think this is part of what I want as a learner.
Yeah. So it's a mix. It's a mix of both, right? The mindset on the student part and how the educational system could also kind of implement those measures. And yeah, what you said about mindset, I think is really important. And it's perhaps the thing that here in Portugal is most difficult to challenge. It's this idea of how getting good grades and um, being theoretically good is what's most important. So you're not really trained into a culture of feedback. You're trained into a culture of performing well cognitively, and feedback is a number. Like you had this in your test, and all you have to do is study more if you want to become better, right? And I see in some internships and students that I know just this fear, this dread of doing things wrong, which I think is what is perhaps the biggest change needed in the mindset, right? Is how do we help students and trainees to lose the fear of making mistakes? Because from such an early point, we are trained socially, academically to not make mistakes, or at least to hide them really well. So yeah, that's again my personal take on it. I think that the mindset change perhaps starts there in the educational system in terms of making room from a very early age for mistakes and seeing or conceptualizing mistakes as a part of growth and expertise, right? Yeah, so maybe we can start with you, Stephen, and end with Gideon before we open the Q&A. Looking ahead 5 to 10 years, what do you hope the next generation of deliberate practice research or training will achieve? And what could be, again, going into idealization, which is not a great starting point, but again, we want to be hopeful. What do you think is your ideal vision of where this movement of deliberate practice training is heading?
So my vision is fairly simple. I think having that agreed definition of what is deliberate practice when we're using it, what are the components of that as well, and for research, not only agreeing on a definition, but designing deliberate practice interventions or educational support structures around principles that truly align with that. So I think that is, when I look at that literature that's there and all of the papers that were there for the review, that's the key thing, because if that was there, it would be so much easier, even though these are small studies, little numbers, to feel that confidence as well around when I use the word deliberate practice, this is what I mean. Because at the moment, I've got no idea what anyone means when they use it, unless we come to a point where people know that this is what it should look like.
Thank you, Stephen. And Gideon, maybe to wrap things up, I'd like to hear what your vision is.
Yeah. Yeah, I agree. I agree with what Stephen says, and it'd be nice in the next 5 to 10 years to have more definitive answers, um, more clarity around DP, but also more clarity around structured practice or purposeful practice, which might be very good in their needs and much easier to perform as well, and good comparators to compare, DP against. So yeah, so just well-designed studies that are close to the definitions, that compare each other and more answers. Yeah, that's it really.
Great. Thank you so much, both of you, for taking the time today to explore your paper. We don't have a lot of time, so I'm going to go and jump to Q&A. We have a question from Maria Lind, and she says, working as a supervisor, if I should add one thing from deliberate practice, what should it be that could improve my traditional supervision in regard to where the research is now? Any of you would like to jump in?
That's I don't know, a hard one. So if, I'm assuming working as a supervisor without using deliberate practice right now, um, what should it be that could improve my traditional supervision in regard to where the research is now? I don't know if I have an answer, because the minute you don't apply all the features of DP to the supervision, it's no longer DP. Um, but just give it a try. With one student to begin with, so it's controlled and it's manageable, and see what the results are, and then publish it as a case study.
Yeah. Anything you'd like to add, Stephen?
I think just having a very deliberate approach to how you're trying to use deliberate practice as a supervisor and within supervision, and I think, thinking, are these components here? Am I actually listening to this learner and developing goals with them based around where they're at? And reflecting on that usefully, and probably getting feedback from the learner as well, about, as a supervisor, are these the things I'm doing? Is this what's happening here?
Vidar, you want to maybe share
Yeah.
your as a deliberate practice supervisor, perhaps?
Yeah, I think this has been super interesting, and I've been very eager to discuss also as we have been talking. But I think, yeah, we could do that later also. I think it's been very nice to have you with us, and I think I put in some resources in the chat if some of you want to attend more of these events that we do in the International Deliberate Practice Society. What really is resonated a lot with me is your term "moving the needle." You said that a lot, Gideon, and what you said, Stephen, about being cautious, curious, and optimistic. I think that's really good things to take home, to continue to be cautious, curious, and optimistic together, and try to move the needle. I think we have that in common, that we try to develop better help, and yeah, it's been really nice to hear about your study. And I also linked for the study in the chat if anybody didn't got the time to read it yet.
All right. Awesome. So yeah, I want to thank again Dr. Stephen and Dr. Gideon for joining us today. Me and Vidar, want to thank everyone who's joining us from different places, different time zones. And yeah, I really hope to see you again in our next events. Could be a research talk, could be a workshop, something, we don't know. But we hope to see you soon, and we really appreciate you taking the time to be here today and advance deliberate practice with us.